Hey everybody, today I'm going to talk about something that's a little bit serious, and it is transgender healthcare. An estimated 1.4 million people in the United States are reportedly transgender. I believe that there needs to be a change in the healthcare system to meet our needs. For a lot of trans people, healthcare is limited because of lack of insurance. But for even of those people that have insurance, accessing healthcare can be very difficult. In the last 2 years, I've found myself in and out of doctor's offices and hospitals many times. And each and every time, I've had to out myself. I have identification that states I am male. It states that I have a male name. And I present as male. But still, I get misgendered. Still, they put the F on my wristband. Now, I understand that in a lot of cases, they need to know if you were assigned female at birth. Leave it on the chart. But why put the F on my wristband? I understand that, and especially with my insurance, we're fighting with them right now to get my gender marker changed to M. But nobody seems to be able to tell us how to do it. The insurance company is telling us that my wife has to go to her job and go to HR and tell them. Well, HR says, well, we don't know what to do with this. You need to call your insurance company. So it's just, nothing is easy. Meantime, you're in the hospital and you're in the emergency room and you're already in a fragile state, mentally, physically, maybe you're in pain, and I'm sure you probably are in pain if you're at the hospital. And throwing that F on that wristband can throw somebody into, a dysphoric episode. I mean, dysphoria just raises its ugly head then. I've been to, like I said, countless doctors, and I've been misgendered by them, by the registrars, by nurses, by the technicians, by so many people in the medical field. And I have to educate each and every one of them. And still, when I educate them, they still come back and they say she or her. Or I'll hear them behind the curtain referring to me as she and her. As a result of this kind of treatment, many transgender people don't seek treatment at all. Why don't they seek treatment? For fear of this kind of discrimination. For fear of being outed. Transgender people have to be outed every time they go to the gynecologist for a pelvic exam. Well, can you imagine me going up to the desk and saying, yeah, I have a 2:45 appointment at a gynecologist's office? I mean, there's just got to be some changes made. And also, for me, especially, I have to have a mammogram each year because of the breast tissue that came back during my pathology as precancerous. So now each year, I have to go and have a mammogram. Now, when I went to have my mammogram post-top surgery, they handed me a Johnny, and they put me in the women's section, sitting with a bunch of women with their little Johnnies on. They were very uncomfortable. I was very uncomfortable. But nobody seemed to care. And I asked them to call me Ty, and at that time, I hadn't changed my driver's license, and they still referred to me by my birth name. And just the other day, I was getting a chest x-ray, and the technician handed me a Johnny. And I handed it right back to her and said, I don't need that. And she says, you don't? And I said, no, I don't. I could go on and on about this, but the bottom line is we all need health care. We all need health insurance. And we need to be able to access health care without all of this kind of drama going on. I don't know what can be done, but somehow, some way, we need to make some changes. That's all I have for you this week. Hopefully I'll talk to you soon on a brighter note. Alright, talk to you soon. Bye.